organized a daily webinar series that is internationally conference. For today's session on the dais is Honorable Negareh Poursalehi ma'am. So I heartily welcome to you, madam. Yeah, on this dais. Then I welcome the chief organizer of an internationally conference, Honorable Dr. M. Bedkar sir. Also welcome all those dear attendees who attended today in the session. The topic for today's presentation is Understanding Autism Spectrum Disorder. The topic is going to present, as I have mentioned, Negareh ma'am, presently serving as a professor at the Department of Medical Biotechnology, School of Medicines, Shahid Sadoughi, University of Medical Sciences from Yazd, Iran. So with this brief introduction, now I request you, madam, please start your presentation on the topic Understanding Autism Spectrum Disorder. You are most welcome.
Thank you. Hello, everyone. Thank you for being here today. My name is Negareh, and I am honored to speak with you about autism spectrum disorder, or ASD for short. Well, my speech will focus on autism in a way that's easy to grasp for all attendees, diverse audience, and everyone, regardless of their background in medical or genetics. I believe knowing, understanding, and accepting this disorder is crucial for both professional healthcare and general public. Well, today I would like to explore autism spectrum disorder world, discuss its impact, and explore the ways we can support and manage this disorder. Let's start with the statistics that might surprise you. According to CDC, approximately 1 in 36 children are affected and are diagnosed by autism in the US. It means that many of us are likely to know at least someone affected by autism around us, whether it's a family member, a friend, or colleagues. In addition, boys are nearly 4 times more likely to be diagnosed with autism than girls. Well, what is autism? Well, a quick explanation. Autism is a neurodevelopmental disorder. Is a term that describes a variety of neurodevelopmental disorder differences in communication, interaction, behavior, and challenges also. For example, some patients can speak fluently and normally, while some other cannot speak even a single word. Or some patient and autistic people have intellectual abilities, while some others may not. Any person with autism has a distinct set of strengths, ability, and interests, and each person is unique. The word autism comes from the Greek word autos, means self, and the literal translation of autism is alone, because most of them like and prefer to be alone. They prefer to play alone in their childhood, and they have trouble in their communication and interaction with others. What is important is that autism is a spectrum disorder. It means that it's a different variety and wide range variety in each person, and each person is unique. As I mentioned before, some people can speak normally and fluently, and while some others may not. It's not a linear disorder. Well, common symptoms of autism include a lack of eye contact. They like to do repetitive activities, doing something over and over, like repeating words or phrases. They are high sensitive to sounds, touch, and smells, or sights that seem ordinary to other people. They may not looking at things when other person point at them. And problem understanding or using a speech, gesture, facial expression, or tone of voice. They may not respond to their names being called, and they're trouble adapting to changes in their routine or in their environment. They may feel and experience delayed speech and language skills or lack of language in early ages. And there are a strong resistance to change in their routine and difficulty with social interaction, such as making friends or playing with others, and so on. Autistic people may find it hard to communicate and interact with other people, may find it hard to understand how other people think or feel. They may find it hard to look at the other person's eyes directly and find things like bright light or loud noises overwhelming, stressful, and uncomfortable. They may get anxious and upset about unfamiliar situation and social or in a social events. They may take longer to understand information, and they like to do things over and over. Well, the different kinds of autism are generally grouped into 3 different levels based on their severity. 3 levels are a high-functioning autism, low-functioning autism, and classic autism. The first level is high-functioning autism, HFA, is the first level. This type and this stage is the milder type of autism. Autistic in this level may be very intelligent and are able to handle their daily life. They may be really focused on topics that interest them and discuss about them non-stop. They have much harder time socially and difficulty initiating social interactions, and clear an example of a typical or unsuccessful response to other. They are able to speak in full sentences and engage in communication. The next level is low functioning autism, LFA. People with LFA typically have a very difficult time communicating verbally and may have limited speech or even be unable to speak at all. They often have severe behavior problems as well, and they also may not respond to their names being called. The next level and the severe type is classic autism, or CA for short. This level requiring very substantial support. They typically have severe communication problems, including severe communicating problems, interacting others, and severe problem taking care of oneself. Those with this level autism will need the most support. What is important is that autism is not an illness. Being autistic doesn't mean you have an illness or disease. It means your brain works in a different way from other people. Autism is present from birth, and symptoms and signs of autism might be noticed when they are very young, in early ages, or later in their lives. Well, what causes autism? The exact causes of autism are still under investigation, but research suggests that it's a combination of genetics and environmental factors, and these 2 factors play a key role. Genetic studies have identified various genes that may contribute to the risk of developing ASD, but no single genes or environmental factors explains all causes. Nowadays, one of the greatest controversies is about focuses on autism, whether a link exists between autism or any vaccination, childhood vaccination or other types. There is no reliable research that shows autism is not caused by vaccinations and is not caused by bad parenting or bad diet or any particular diet. It's not an infection you can spread to other people. It's just a complex neurodevelopmental disorder. What we are certain about is that genetics play a key role in autism. Only identified specific genetic causes in 10 to 20 of cases, and these cases include specific disorder and disease associated with ASD, such as Fragile X syndrome and rare changes in genetic code. And autism is hereditary. When one child receives an ASD diagnosis, the next child has about a 20 greater risk of developing ASD than normal situation. And when the first two children in a family has autism, it's about a 32 greater risk of developing ASD. Interacting with autistic individuals requires understanding, patience, and respect. Please treat with them with the same respect you would offer to anyone else. And be patient as they might take longer to respond to experience themselves. Be direct and specific in your communication. Use clear and concise language. Avoid using any phrases, complex phrases, or idioms. Recognize that each autistic individual is unique with their own set of challenges, abilities, and interests. Well, autism awareness continues to grow, especially as more and more celebrities open up about being neurodivergent or autistic. Many scientists, actors, models, or artists or many famous people are autistic. And such as Anthony Hopkins, a famous actor, it was diagnosed with ASD as a child, or Albert Einstein, scientist and mathematician. There is no way to know for sure, but many experts believe that he would qualify as having ASD today. And Elon Musk, well-known entrepreneur, famous figure behind Twitter and Tesla, announced that he was on autism during his childhood. And he announced that this news in a show hosting. It was in May 2021 in Saturday Night Live, I think. Some of people I've mentioned have official diagnosis of ASD, and other may not have an official diagnosis. Some of them speculate that these individuals would like having qualify as having ASD disorder. I mentioned more famous people in the left side of my slide. What is important is that these people have been recognized for the amazing thing they have accomplished in the world. They have touched the lives of so many people in a positive way. Autism spectrum disorder looks different in every person with the condition. Although it is important to remember that many people with autism will need much more support than others. And people with autism can live a fulfilling life, especially when they are embarrassed who they are as being autistic. And I believe by knowing, understanding, and accepting this disorder, we can create communities that autistic people can thrive and shine. And thank you for your attention. It has been a pleasure sharing this topic with you, and I open up to any question you may have.
Thank you so much, ma'am. Wonderful presentation you have made now on the topic understanding autism, a spectrum disorder, very clearly. Thank you so much. Now it's time for discussion. Dear participants, I would like to request you all, if you have any query, please come ahead. Discuss with keynote speaker. Dear participants.
Good evening, ma'am, and good evening all. Thank you, Honorable Principal Dr. M. Bedkar, sir, Prashant Negareh, sir, Dr. Prakash Karad, sir, and all organizing committee members. Thank you so much, ma'am. Your lecture is a very informative, knowledgeable, and interactive session.
Thank you.
You have made very wonderful and excellent presentation. Today's topic is very good. Understanding autism spectrum disorder. It is a developmental disability that results in problems with behavior and communication. This disorder can be identified in children aged 2 to 3. I have some question, ma'am. First question is, what are the 5 disorders on the autism spectrum? Second question is, can an outside child speak normally? This is the second question.
Thank you for your question. I didn't catch your first question. Can you repeat it? Okay. It's depend of the abilities, and it's categorized in 3 groups, as I mentioned before. It depends on their abilities in their making communication and interaction to others. And the second question was,
can an outside child speak normally?
yes, definitely. Some of our autistic patients can speak normally and fluently, while some others cannot. But most of them have problem with their language.
I think that your explanation is very wonderful and excellent. Thank you so much, ma'am. And my dear colleague, I express my sincere thanks to Honorable Principal Dr. M. Bedkar, sir, for your support, cooperation, guidance, and well wishes for every times. Thanks a lot.
Thank you for your attention.
Ma'am, can these autism children lead the normal life? Can these autism children lead the normal life?
Can autism? I didn't catch that. Sorry.
Can autism children can be lead normal life in future, or they will always have the communication problem when they become at the age of 25?
Well, there is no curable disease and disorder. Just intervention, just early interventions can reduce their symptoms and represents, and they can live fulfilling life with this disorder.
Thank you, ma'am.
Thank you for your attention.
Is there anybody having a question? Please come ahead. I think there is no question now. Thank you, Dr. Kendre sir and Prashant Tote sir, for your nice questions. And ma'am have explained it. So thanks a lot. Now I request the chief organizer of an international conference, Ideal Principal Dr. M. Ambedkar sir, to conclude the session, please.
Thank you, Prashant sir. And today's resource person, Negareh madam, who is from Department of Medical Biotechnology, School of Medicine, Shahid, Sadoughi University of Medical Sciences, Iran. And she delivered a talk on understanding autism spectrum disorder. It was a very best speech, scientific based calculations, figures in the PPT she have included, and we understand more about the behavior of these children's age groups, types of the autism, what are the causes, and how they can behave normally or not. And moreover, those who are well-known personalities, those who are having this type of autism behavior. So this was a very best speech, scientific speech. She's from study. She did the study of genetics. She's researcher, neuroscientist, coach of the Iran national squash team, and she hold degree in medicinal biotechnology with focus on genetics, because genetics is the very important branch and it's a deep branch of scientific. And she reflects her commitment to the field of sciences. Being a student of sciences, she is very curious about the scientific facts, and she is currently doing her professional as deep intervened and neurosciences and whole exomes sequencing, WES, this is the short form of it. And she is dedicated to unrevealing the complexities of the neurodevelopment, rare diseases, pursuit that is the both intellectually simultaneous and profoundly rewarding, because there are so many diseases which are related to genetics, and science is also discovering all these facts, and research is going on too much extent level, important level, that it may give some best results for the future to diagnostic the disease, to cure the disease because of these genetical sciences. So this type of speeches are expected from the scientist level to this dais. And she also did our as a guest, she did the best speech today for the autism behavior, and we all are happy with her presentation. We request her in future also, if she got some time, she can spare a time for us on another topic. We are eager to listen her in next future also. She can invite her friends, join here as the participants or as a speakers. We welcome all. Thank you, ma'am, for your best speech. And we are seeing that you are having a medal in your background side. So, in which competition or in which exam you have won, we congratulate you. And in future also, we wish all the best for your future research. Thank you. Thank you.
Thank you, Dr. Beskar, and thank you for this great opportunity. I have been playing squash for 17 years besides my major, so that's the model of that.
Just wait for formal vote of thanks from our team. Okay.
Thank you, sir. Thank you. Now I move towards the vote of thanks. Sri Kumar Swami Mahavidyalaya Ausa, District Laturi in Maharashtra State. As we know, dear participants and all, we are organizing this world record series as well as the international conference. Sometimes national conferences. Every day we are coming with new topic, with a new sense, with new guidelines. It touches to all the fields in the universe, in the world. So we are just organizing to just provide different kind of knowledge in front of you. And the topic for today's presentation was understanding autism spectrum disorder, which have been explained. Now, Honorable Negareh ma'am, so nicely, clearly, ma'am have covered all the aspects regarding the topic. What is autism, its causes, then common symptoms and signs of autism, and the different levels in the autisms and autism is not an illness, but what is it? Clearly, ma'am, you have explained. Really, it's a very wonderful explanation you have made now. So thank you so much on behalf of the organizing committee members. You paid your valuable time in the session. Thank you once again. I thank the chief organizer of an international conference, Honorable Dr. M. Ambedkar sir. Then thanks Dr. Kendre sir, Prashant Thote sir, who have nicely discussed with the keynote speaker. And at last, I should not forget to thanks all dear attendees who joined today. Now I request you all, please fill the feedback link which is given in the chat box. So with the kind permission of chief organizer, I declare today's session is over. Madam she was from abroad. I think from Iran, she has joined the session. So once again, I thank you so much, madam. Bye bye. Take care.
Thank you very much.
Thank you.